Welcome back. Now, it seems period poverty is alive and well in South Africa in 2023. That's right, we're still having this discussion in this time. Research conducted last year by the Menstruate Movement found that 83% of learners did not have regular access to menstrual hygiene products, and this impacted their school.
Good evening, and thank you so much for having us. So last year, at the end of 2022, we conducted research to understand how learners in 18 schools across the country are managing their periods. How are they managing their periods? So we're asking them questions on access, questions on education, and also their general experience of menstruating. So some of the key findings from our research, when we analyze our research, they state that plus minus 83% of the learners surveyed do not have regular access to menstrual hygiene products, meaning that they do get them, but they have to alternate. So if you get them this month, you're likely to get them in the third term or fourth term. You can't get them on a monthly basis because they are not enough. And plus minus 80% of the schools that we surveyed, they normally rely on NGOs, so they rely on donations. They are not getting any from the Department of Education, which is, I think, bizarre for us because there is a program of distributing dignity packs in schools. And if these schools that are situated in in the metropolitan cities or capital cities do not have access, then what's the situation in rural provinces or schools situated in rural provinces? Yeah. In rural areas, sorry.
So, and Tracey, as you make that point, sorry for interjecting this, you make that point, I then also equally wonder if the pupils are saying that they don't really get those, dignity packs monthly, what then happens to them? Does it mean they stay away from school? Does it affect the schooling curriculum?
Yes. So that's the case. So about 1 out of 4 learners we surveyed, they said that they have to miss school. So they miss plus minus 10% of schooling year every year, of course. So those are some of the things that they are impacted because they don't have access to menstrual hygiene products. The second one, the learner spoke yesterday, Jessica, from one of the schools situated in Pretoria. She also mentioned that she can't participate in her, favorite extracurricular activities because of lack of access to menstrual hygiene products, sanitary pads. Then the other one is also the fact that I think it strips you of your dignity as a young girl. Yeah. I remember when I was in school, how difficult it was to concentrate in class if you are not using a pad because you're now like using an alternative like a toilet paper, and those are some of the things that came out yesterday during our launch of these findings.
And Tracey, we also know how, mean school kids can be should, a pupil spot, have an accident and you're wearing your uniform. That could be embarrassing. You could be teased the whole day if you're not, wearing the right support, just in terms of a sanitary pad, and you have the right products to make sure that you're comfortable throughout the day at school. It could be really an embarrassing experience. And I suppose that's why it contributes to most girls staying away. I also want to talk about the pressure this puts then on teachers as well as principals, on the school overall. What do they have to go through should the supply from the Department of Education, from government, not be sufficient? Can schools handle it on their own? Do they have donors supporting them, supplying them to ensure that all the school pupils do attend schools and do not lack when it comes to these products?
So the schools that we visited, the 18 schools, as I've mentioned earlier, we also spoke to the principals or the teachers who are in charge of assisting learners with managing their periods. So they said that they have to, out of teaching on a day-to-day basis, they also need to think about how do we get donations from the big companies? How do we get donations from NPOs like ourselves? But at the same time, sometimes they have to use their salary to buy sanitary products, because you can't say, I don't have it, when a learner comes to you as someone who they trust, you need to do something. So sometimes they have to use their salaries to ensure that learners have access to dignity packs or they have access to sanitary products. So when we speak about dignity packs, we're speaking about the whole, what makes a toiletry, our toiletry bags. So from your roll-on to your soap, sanitary product, toothpaste, all of those things. And I think in South Africa, because cost of living is becoming higher, it's quite difficult for parents to choose to buy sanitary products over a loaf of bread. So those are some of the things that teachers are dealing with in the school premises. And those are some of the things that parents are also dealing with, because it's not nice to just say, I don't have money for sanitary pads. You need to do something as a parent, but also at the same time as a teacher, because a learner comes to you saying, can I have a sanitary pad? Because they trust you. It's also not an easy topic for, school-going learners to speak about menstruation. I think it's difficult for us as adults to speak about it. So imagine what it takes for them to go and ask for sanitary products from, their peers. So those are some of the things that, were highlighted by the learners we spoke to. And also the other issue that came up, even from the teachers, is how they teach about menstruation. So they do have, a section where they speak about menstruation during the life orientation curriculum, but it's not sufficient. So even though they said that they were taught before, some of them, when they had their periods, they were still shocked. They felt embarrassed. They were scared to tell their parents. So those are some of the things that you see and you hear when you speak to young people on the ground about their experiences. And they don't want to open up. So you need to share your own experience.
Right.
And luckily, because I came from a working class community, I went to a public school. I also had my share, fair of experience, bad experiences of menstruation. At least I'm able to share some of those, and you'll see them opening up and, trying to respond honestly to these questions that we're asking.
And I think what was also, effective with this engagement that you conducted, Tracey, is that oftentimes such conversations may still be taboo. Young girls may be taught, don't talk about it, especially to strangers, anyone you don't know. You don't talk about that area of your body or what happens in that area of your body. It's taboo. So you demystifying some of those myths and saying, listen, we are all women. We are all, we went through that phase. It's a safe space, but we're all just trying to come up with solutions to ensure that what you go through naturally doesn't hinder on your potential because you're still of school-going age. Before I let you go, any recommendations that came out with these findings? I know that on Thursday you conducted a lengthy panel discussion, with various experts, from Dr. Griselda Kananda, Dr. Mpumezenda, who's a doctor, a gynae at that, Solufelo Lerato Poko, a teacher, as well as that grade 10 learner you told us about. But any recommendations as to how do we move forward? How do we ensure that we don't still talk about this 5 years, 10 years from now, but we're making strides and progress?
I think our recommendation is for us to work together. So the first one, the government needs to show up. So from the President Ramaphosa, Minister Angie Motshekga, the Basic Education Minister, to the Minister of Department of Women, Youth and People Living with Disabilities, Nkosazana Dlamini-Zuma, all of us, we need to show up and to ensure that young people are not, missing school because of something so little like sanitary pads. So the government needs to show up. They need to ensure that they are, planning properly when it comes to the distribution of dignity packs. They need to have conversations with the private sector to say, you have a role to play in society. With those CSI projects, can we collaborate here and there to ensure that we keep young people, especially girls, who are historically disadvantaged in schools? Then lastly, we also need to raise awareness. So we are calling on the Department of Health to ensure that it's also raising awareness about, issues of menstruation in our community. And it's easy for parents to also speak openly and honestly to, their children about menstruation. So those are the key recommendations that came up from our discussion yesterday. And we'll be engaging those different departments about, our findings, but also moving forward, how do we do better by right people? Because we can't continue like this.
And I just want to also commend you, Tracey, yourself and your organization and your team for taking that first step, going to these communities that oftentimes are forgotten and starting that conversation and placing this conversation on the fore and speaking to me this evening. Thank you so much for your time, Tracey Malawana, founder and director of the Menstruate Movement. Quite a lot coming out. Overall findings that they have found as a movement is that 83% of the learners that they have surveyed, which are over 500 pupils, the learners do not have regular access to menstrual hygiene products. This, of course, in turn affecting their school attendance. Something needs to be done so we can make sure that these young girls stay in school.